Well, for us, we were an adoptive family. We have 4 adopted children, and one of the things that was very intriguing for us about the program was that there was a large base of adopted children that suffered attachment disorders of different levels, and that this program, the percentage of children here that were adopted or came from different types of adoptive situations was a high percentage. And so that was intriguing to me. So I asked a lot of questions about the background of kids that come here. And I felt good about the fact that there was a lot of experience here for kids that have experiences coming from an orphanage setting. And so my questions were relative to, do you think you will be safe? What are the types of behaviors that they're dealing with at Calo, and how do they manage that? And the answers were the staff ratio with the children. There was a high staff to child ratio, and that was very helpful with these kids not in a behavior modification role, but in a coaching role with them. So I had a lot of questions about safety, and gosh, he's been very protected in that kind of environment. What kind of things is he going to experience? Like, will he be safe? And I thought that was my biggest concern. And will this really work? I mean, putting all these kids together that all have reactive attachment disorder in teams, how are they going to support each other? Like, how does that work? And so these were questions that I had for Debbie as she embarked, on really trying to share her experiences with me. And what I loved about it was that the whole clinical team met with me in advance when I came to visit, and I was able to ask all the questions. And poor Shelley, I probably called her maybe 50 times, and she always answered. She knew it was me. She knew I had another question, and no question was a stupid question, because it was like a big undertaking to decide who you're going to entrust your kids to, and especially a child that needs a lot of help and a lot of understanding and a lot of safety and supervision. So I really liked that she had already asked all those questions, so she was able to answer a lot of them, but that I was able to sit down with the staff and I was able to ask all the questions that I had, and that every one of them they were able to answer them honestly and directly. And I felt good when I left about the fact that the staff, with their credentials and their level of experience, life experience and work experience, were prepared way more than I was to help my son.